So we'll be presenting two projects actually. The first one being FMCW radar vital monitoring system. So the problem we are trying to solve is traditional methods of collecting this HR and BR data is basically has many limitations such as subject discomfort or cross infection, and basically even in scenarios like neonatal ICU, you don't want to be connecting too many wires to the babies. So what we're trying to develop is a product which is truly non-contact, and you can keep it at the top corner of a room maybe, and then you'll be able to monitor the vitals of patients. It's not supposed to be just in hospital scenario. Basically, you can keep it in a car as well for vital monitoring of the passengers, and you can even keep it in a office scenario where you want to just know whether your employees are fine. So this is one of the scenarios, this is one of the projects we are working on. So here we have developed a unique signal processing flow, and then whatever the signal information we receive from the radar, we'll be processing it through regression models, and then we'll be predicting the HR and BR. So this is the test scenario, for example, in our lab. So here we'll be localizing the subjects, and then for each subject we'll have a heart rate and breath rate signal we'll be obtaining for them. And we have achieved actually pretty good accuracy where the mean absolute error is less than 0.39 for breath rate and 3.64 for heart rate. So this is one of the projects. On to the next project, it will be presented by Srikar. It will just take a minute.
Hi, my name is Srikar, and this is my colleague Alan. So before I tell what this device does, let's take a use case, which is the remote villages, which is limited to the healthcare systems or any kind of diagnosis and screening. So take the case of any respiratory problem, and then, So of any respiratory problem, the equipment that is required to detect the problem will be bulky, expensive. In addition to that, the people also will have the financial and psychological barriers. So to bridge this gap, we present a device called Respire for the early detection of the respiratory diseases. So this basically integrates the features of SpO2 measurement, and then we can also measure the body temperature of the patients. We also record the lung sound for the lung sound analysis. And apart from that, we use a technique called EIS just for the weight estimation of the bacteria or any kind of biosample that is present. So this is close to the RT-PCR testing that is done. So this is currently being clinically validated, and then we are looking forward to get this productized in the next 6 months. Thank you.